Okay, now let's move on to our second topic tonight, which is health. Health is another huge issue, and now the Western Health and Social Care Trust is looking at a deficit at the end of next month of up to £12 million. Urgent action is needed, says the Western Trust, which essentially means cuts to services. So my question is, what can be done to address the issues in our health service? John Coyle.
It's a difficult question. The Western Trust, they're trying to provide the best service they can, but I don't think it is acceptable to cut the services. The people from the West need the Southwest Acute Hospital to be there, whatever emergency they need to be addressed.
Tom Elliot, we hear stories all the time about staff at Southwest Acute Hospital who are feeling under pressure. So how bad is it, and what are you doing to help the staff?
I think the one key aspect is that I think there needs to be a rebalancing within all the health trusts in the Department of Health. We've got much too top heavy in the bureaucracy of the health service. Now some of that is driven I suppose by standards, but they need to have a fresh look at all that process once again, and they need to have less bureaucracy and more frontline services. And I think that is something that can be achieved. I know in the past, in fact the last few health ministers, I would dare to say, have had a go at it and have had some success. Michael McGimpsey actually drove through the review of public administration in health. Probably didn't go far enough, but it was as much as he could do at the time, but it does need another process.
How did you rate his performance as health minister?
I thought he was very good under a very limited budget. Let's not forget the budget has increased significantly since Michael McGimpsey left that post, and it's still under huge pressure. But what we do need to do now is get more into the frontline services and reduce that bureaucracy. I just think, and I'll give you one example of how two departments don't work well together. There is a huge problem at the moment in some playgroups and nurseries around the standards and provisions that are driven by the health service down to the Western Board, and that affect those nurseries and playgroups. That means you can't have affordable childcare in a rural area with small numbers going to it, and that affects the whole economy. And I think that's one section of our government doesn't know what the other section are doing, and there needs to be that better cooperation. That is just a simple example. If two departments work better together, that they could actually bring much better outcomes and put more services into the front line.
Tanya Jones, if you get elected, how will you protect frontline services?
Well, one thing is what Tom's just mentioned, the cooperation between departments. And of course, Stephen Agnew has recently brought in a private member's children's bill exactly to require departments and public bodies to work together for children's services. So that would be absolutely key. I think an important thing to note, we talk again and again about the health service being overstretched. But the truth is, it isn't just overstretched, it's being deliberately sabotaged by people who want to make it into just another commodity in the commercial marketplace.
Like who?
Like our present government, the coalition government. A lot of the bureaucracy that Tom's talking about is there because this internal market is being created where hospitals are competing with each other, departments are having to purchase services from each other in order to facilitate increased privatisation.
Michelle Gildernew, as former chairwoman of the Stormont Health Committee, do you think the health service is in a better place now or a worse place than when you were head of that committee?
I probably don't think that it has improved an awful lot, but I know there's an awful lot of pressure at the minute on staff, and we do need to see more spending on frontline staff.
When you say you talk about pressure, what can you explain a bit more?
I talk to nurses who've worked for 20 and 30 years who say they've never had it so hard. They've never had to work so hard. They're running between patients. They're not able to take time off because for genuine reasons, for sick or for whatever, because of the pressures on frontline staff. So healthcare is a right. It's again a basic unalienable right. It should be universally provided. It should be free of charge, and it needs to be paid for through a progressive taxation system. Some of the best health outcomes around the world are where there is a recognition that if you want a decent quality of health provision, then you have to pay for it. We pay a lot less. The European average is 8% of GDP, and we pay a lot less than that into health. I'd agree with Tom in that is top heavy with management. I also believe that we could do more in terms of prevention, in terms of early intervention. I was involved in a debate in the Assembly a few years ago where some of the parties were arguing that early intervention started at age 5, and I was saying if you wait to 5, you have missed a child's formative years. You've missed a chance to have a significant impact on that child's health and economic and social well-being. So prevention starts not even at birth, but pre-birth. It starts with providing support to families, to giving the support and the services that are needed. We need to rebalance in terms of primary care versus acute, and we need to have a focus on prevention rather than cure. And I mean, we have fabulous people who work in the health service here, very, very dedicated people, very committed to what they do, and the problem is we don't spend enough money on health, and we have unrealistic expectations of what the health service can do.
Okay, any questions? Yes, I think you're the only one, Rosemary, yes? Sorry, you get a microphone for Rosemary?
Do I really need it?
You don't, Rosemary.
As MP for this area, Michelle, what have you done for the future of the South West Acute Hospital, the only hospital in Fermanagh South Tyrone, and which seems to send all its patients with any degree of severity at all up the road to Enniskillen or to Belfast? And in line with the Donaldson report, what do you see as the future of the South West Acute Hospital? And can we not develop the cross-border aspect of it?
I agree wholeheartedly, Rosemary. We have to develop the cross-border. That's one of the reasons that I argued that the new hospital should be located in Fermanagh. I felt the further away it was from Enniskillen, the better chance we had of its long-term sustainability. And also the fact that then the catchment area was into Cavan, Monaghan, Sligo, as well as Fermanagh and Tyrone. So there's been a huge amount of work over the years on not just on securing the South West Hospital and its site and the building, but securing the services. And you're right, we have women now who, once they're over a certain BMI, they're sent to Enniskillen as a matter of routine. Now, I don't believe that that's necessary. I have written to the Chief Executive about that. I agree with you, Rosemary. I know there are GPs who have to take a decision whether to send somebody with a hip fracture up over Scrahy to Enniskillen, or are they better getting less treatment in the Southwest but been able to stay there and where they're closer to friends and family. So I think that there is certainly a drive to centralise health services across the board. I was furious at the Donaldson report and about what it contained, because if you take it to its logical conclusion, outside of Belfast and maybe Derry, people here we'll be second-class citizens in rural areas because there won't be adequate health services. So we've got a situation in Belfast where I think there's 11 hospitals in and around the greater Belfast area, and when the Donaldson report, when I listened to Liam Donaldson on the radio, he was clearly thinking about hospitals like ours, like Daisy Hill, like Antrim, like maybe Craigavon, that wouldn't be sustainable in the future. I've come from a meeting earlier where the air ambulance was discussed, and again, there are lots of things that we could do to provide better healthcare for people in rural areas across the board. We're an island of 5 million people. We have to plan on that basis. We have to make decisions that provide the best quality healthcare across the island, and that means cooperative working. We did a meeting a number of years ago on cooperation and working together on COT with the then Health Minister, whose first question, after hearing a fabulous presentation about the kind of services that were being provided for the first time in rural areas, and his first question was, what's in it for Belfast? That's what you're up against.
I mean, you're talking in generalities. What have you done as an MP to ensure the future of the South West Acute Hospital?
Well, I've worked very closely with the department, with the local Western Health and Social Services Trust. I've lobbied on behalf of the hospital, and I've lobbied the people who make decisions in this area to ensure that services are located there, and that they're quality services, that they're safe. And I don't believe that we should be taken as gospel when somebody thinks that maybe it's a good idea that a woman is slightly overweight, or that she can't have her baby at the Aaron Hospital is one thing. Again, hip fractures. There are things that we need a critical mass. So the stroke operation, for example, when it works extremely well. But if we locate those services outside of areas like this, then we're putting our people. So I have worked tirelessly on this issue, will continue to. Whether I'm the MP or not, I believe fundamentally in quality healthcare provision, not just at acute level, but at primary level, social services, mental health, across the board.
Okay, we have another question here.
Thank you. My name is Elizabeth Bradley. As a parent of a child with a disability, I can tell you we are already second-class citizens, I think, in this part of Northern Ireland. And also, Tom mentioned there about departments not working together. I could give you 20 examples of departments that don't work together to support children with difficulties and needs. The education, the debate's been had, but it's definitely not sufficient for the needs that are there. But actually, my question is about transforming your care, and how do you feel that policy, which is now being rolled out, do you think it's working? Do you think it's worthwhile? It doesn't seem always very popular amongst people. And how do you feel about the other policy which is now coming out in England, where people will be given the money that would have been spent on them, and they buy their care from local providers? Do you think that's the inevitable conclusion?
Thank you. Tom Elliott, you're an Assembly member for this area. Would you like to take that?
Okay, thanks Elizabeth for that. And, totally agree with your issue, and it's not just around children with disabilities, it's around a whole range of things. And the cooperation is abysmal, to be honest. Transforming your care is a good idea in theory and look good on paper, but now that it's being rolled out, it's not working. Not working at all, because they promised to put, remind me if I'm wrong, but I think it was 60 million into the frontline services and areas like domiciliary care and people, keeping people in their homes. What they're actually doing is removing that money from the primary care, but they're not putting it into that other frontline services. It's disappearing into the entire process. So it is not working. And I would have supported the process if it works right. So what we've got to do is try to ensure that whatever they promise to take money away from somewhere, that they actually do put it into that frontline service. And I have to say, keeping people at home is a great idea, and I think a lot of people want that. Now, the reality of it is they're continuing to close down or reduce the numbers going into residential and nursing home care, but they're not putting the funding into the domiciliary care to provide for those people. And I'm sure Michelle and John even and other elected representatives will have the same bundle of mail as I have about not getting that help and support when they need it. And I can tell you something, some of them are not asking for the world. They're asking for a few hours to give them assistance just to allow them to stay at home. And they're just not getting it. And I think that has broken down. It's not just that it's not working, it's starting to break down.
The policy creates more carers, and there's not enough respite or support for the carers to do the caring in the home.
Yeah.
That the policy is meant to,
yeah.
It's meant to bring forward. It's just.
And there's two sets of carers. Obviously the carers from the agencies and from the trust, who are very poorly paid, I have to say, to start with, and go out all night, hours of the night and day, in all weathers. And then you have the family and the friends carers as well, who I have to say are worth billions to this province.
Okay, just very quickly, Michelle, because I want to get to Dara, because he's got a final question on this topic.
Absolutely, Elizabeth. Well, first of all, we're against privatisation. Transforming your care, those three initials could mean taking your chance. And the people, the carers in our society are, without doubt, the people that we have to value the most, and we don't. I had a meeting yesterday. This constituency obviously stretches beyond Fermanagh, and I had a meeting yesterday with the Chief Executive of the Southern Trust about the crisis response for the carers of people with severe mental health problems, the kind of crisis work that needs to go into that, and to try and give people more respite that they can better do their job. But transforming your care, just very quickly, Tom talked earlier about working in silos, two departments. Department of Health has the worst silos of anybody, and when we were talking to somebody about getting a dietitian appointment and getting onto to getting Meals on Wheels. On one hand, there was money being taken out of the pharmacy budget, but it wasn't. A few pound into the preventative package would have had far better consequences in the community, and the Department of Health has the worst silos of any department I've seen or worked with.
Okay, thank you. Is that okay, Elizabeth? Dara, last question.
Dara Riley from Newtown Butler, St Michael's College as well. Mr. Elliot, are you against privatisation? And if you are, will you fight against it? And how will you fight against it if elected?
Privatisation in health, Dara?
Yes.
Yeah, I am against privatisation in health. What I want to see is a good old National Health Service where you get care from the cradle to the grave. So I am against it. That means, to be fair, getting a system in place that works. And I go back to the issue that, and I agree with Michelle on the issue of silos within the departments, not only within the Department of Health, not only within their own agencies, but actually within their own sectors. Now, again, I like giving examples. My late father, when he had broken his hip at one time, and he was in hospital for an extended period because he had taken chest infection. They wanted to put him into a nursing home because they had spare money in that budget, but they had no money for the domiciliary care to let him home. And we were insisting we wouldn't let him into a nursing home. And we had to take him home without any care at that stage until there came a bit of money available. And they couldn't switch a bit of money, even from allowing him to stay at home from their budget that was in the nursing home provision. So I just think it needs much better management, and it needs to be much more frontline service driven, which is not. It's back end driven.
Can I respond quickly to that, Rodney? Because privatisation is going to affect the most vulnerable, and what we have at the minute is a cabinet of millionaires. The Tory party, which Tom's party had been involved in the UCOMF project a few years ago, where they stood at a Westminster election as a cooperative. I'm not sure how it's best described, but the Tories are the people who are most for privatisation, who are driving down the level of spend, and who are putting vulnerable people in very, very difficult positions. And I believe that another government led by the Tories will be a disaster for disabled, for young people, for the elderly, for those who are living on the margins and who are struggling to get by.
Okay,